Good afternoon. Welcome to the St. Clair County EMA office for day 217 of our fight against the COVID-19 virus. I'm joined here with Chairman Mark Kern and, of course, Sam Bierman from the Health Department. We've got a special guest that's going to join us later on in the program, but we want to hear the numbers first.
Yes. So as of today, 103,391 St. Clair County residents have been tested, which is an increase of 1,082 from yesterday. We are at 8,309 positive test results, which is an increase of 60 from yesterday, and that does include both men and women from under the age of 10 up to their 90s. Today, our daily county positivity rate is 5.5%, and we are at 95,082 negative test results. Unfortunately, we have several deaths to announce today. We are announcing 5 new deaths, which does bring our total for St. Clair County to 213. We had a male in his 70s, a male in his 80s, a male in his 90s, and 2 females in their 90s, all who did have pre-existing health conditions. And as always, our sympathies go out to their family. And we hate announcing even a single death, and days like today where we're announcing multiple, it doesn't make it any easier. So for those who have completed the IDPH required 10-day isolation period, we are at 7,546. For state totals, 6,618,768 have been tested, with 336,174 positive test results, which is an increase of 4,554 from yesterday. And for deaths, the state is reporting 9,165, which is an increase of 38 from yesterday. For hospitalization numbers for St. Clair County, currently we have 47 individuals that are admitted due to COVID-related reasons, and 2 of them are on ventilators. And regionally, we have 88 individuals that are admitted due to COVID-related reasons, and 5 of them are on ventilators. For our long-term care facilities that are in outbreak status, we will only announce any facilities that have had changes. We do have a new facility adding to the list today. Brightly Senior Living has 2 cases and no deaths, which is an increase of 2 cases. Caritas Family Solutions in Belleville has 43 cases and no deaths, which is an increase of 1 case. The Esquilin Dammert Center at the Shrine has 45 cases and 8 deaths, which is an increase of 3 deaths for that facility. And Parkway Gardens has 8 cases and 1 death, which is an increase of 1 death for that facility. We do have some testing coming up next week for anyone that is interested, and we are encouraging everyone to go out. Monday and Tuesday, October 19th and 20th, there will be testing at Southwestern Illinois College, and they will have a walk-up and a drive-through option for that facility. And then also on October 21st and 22nd, which is Wednesday and Thursday, at Clair Fairgrounds in downtown Belleville, and that will be from 8 a.m. to 4 p.m. And all of this information will be on both the Health Department Facebook page and website, as well as the EMA Facebook page. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll move into the zip code report. So the past couple days, we have not had zip codes, so these numbers today are for the 14th, the 15th, and today, the 16th of October. 62201 goes up 2 today to 261. 62203 goes up 6 to 241. 62204 goes up 3 to 166. 62205, we added 3 COVID positives today to bring that total to 226. 62207 goes up 1 to 262. 62208 goes up 6 to 485. 62220 goes up 5 today to 646. 62221 goes up 12 to 766. 62223 goes up 9 to 511. 62225 goes up 2 to 35. 62226 goes up 29 today to 877. 62232 goes up 8 to 219. 62239 goes up 3 to 133. 62243 goes up 5 to 125. 62254 goes up 2 to 283. 62257 goes up 1 to 40. 62258 goes up 1 to 208. 62260 goes up 1 to 164. 62269 goes up 26 to 672. 62282 goes up 1 to 15. 62285 goes up 5 to 143. And 62289 goes up 1 to 8. So we're caught up now on the zip codes. Hopefully the state doesn't leave us hanging anymore, so we'll be able to report daily as we do. Let's look at the daily county positivity today is 5.5%. That brings our 7-day rolling average to 5.9%. The state pegs us today up, and they're putting us at 7% today. We don't like that number rolling up. You know, we were at 6.5 and below, well below, and now we've moved up to 7%. And the way we're getting to that number is consistent as in the past. Bond County comes in today at 25.4%. Clinton County comes in at 20%. Madison at 7.2% today. Monroe's at 9.3%. Randolph County at 6.9%. St. Clair, once again at the bottom, 3.5%. And Washington County at 4.7%. So Herb, you going to introduce our guest for today?
Yes, we mentioned yesterday that we have a young lady with us that is a victim of the COVID-19, and I first learned about Monica and reached out to her, one, to check on her because she's been a member of Team St. Clair following us and spreading the word out there, and unfortunately is a victim of it. So Monica, we appreciate you joining Chairman Kern and us today. How are you feeling?
I'm feeling better today. It's been a long ride.
So Monica, can you tell us just kind of the history of how you think you might have contracted this? Was it hard to get? Was it easy to get? Did you know that you had it before you got tested?
So I feel like I've been one of those people that has been pretty cautious. And I couldn't tell you where I got it from. I'm not sure. I do the grocery shopping for my household, so I could have picked it up maybe at the store, maybe the gas station. I'm not sure. It started out just as a head cold. I felt like maybe I was getting a sinus cold, some congestion, and the symptoms developed fairly quickly, day by day. I started out Tuesday feeling like I had a head cold. Wednesday, I felt like I was having some really bad body aches and was extremely tired. I was finding myself sleeping for hours on end and could not taste or smell. Then came the nausea and the vomiting, the fever, and it just kept going. So for about 6 days, I had a hard time getting out of the bed. I had a hard time stomaching any type of fluids or any food or anything at all.
So you didn't have a cough, though. A lot of times we hear about that. So your symptoms kind of manifested themselves a little differently?
Yes, the cough didn't come until later. Now I do have a little bit of a cough, and I have some congestion, and I find myself having a hard time catching my breath, especially if I'm up moving around. If I'm just sitting down or just laying around, I feel okay for the most part now. But when I start moving around or trying to do anything, I begin to feel weak and tired, and my heart starts racing, and I start coughing and reaching for my inhaler.
Sounds scary. Are you medicating with just over-the-counter medicine, or did your doctor prescribe anything? Not that you're going to tell us what kind of medicine, but just, is it over-the-counter prescription? Is that what you've been getting?
Yes, I notified my doctor as soon as I got my results and told him that I was positive for COVID. I do have asthma, so it kind of made me panic a little, not knowing what to expect. He said that there was nothing that he could do for me. The best thing that I could do is drink plenty of liquids and just lay around, and you have to let the virus run its course.
How high did your temperature get?
My temperature got to 101, and my 14-year-old son got to 102.
So your 14-year-old son has this also,
Yes.
and you got it about the same time?
He got it. So his took place right after. So my symptoms started. I would say my COVID symptoms started on Wednesday of last week, and his symptoms started on that Thursday.
So that's doubly difficult. Not only do you have to take care of yourself, you got to take care of your son too.
Correct.
And how's he doing?
He's a little more sick than I am. His progression is following behind mine, so he's still kind of laying around. This thing really tears your stomach up, so you find yourself pretty nauseated, having diarrhea. People are trying to say that this is like the flu. This might be like the flu times 10.
Really bad, something that that people need to know about, and that's why we appreciate that you're on here talking to us. Herb?
Well, Monica, you said you were one that you felt that you were cautious. Were you wearing a mask when you were going out? I mean, we say that we ask people and encourage them to do that, and we know that's not 100% the safety net. But, I mean, when you say you were one of the ones that was being cautious, can you kind of elaborate on that? I mean, it's hard to say where you got it from, but you definitely got it. I can tell from talking to you, and your results say that. But I just would like to know, for the viewers that's going to see this, you said it's 10 times worse than the common cold or the flu. I mean, is that really what you feel?
Well, the first 5 to 6 days, I kind of felt like maybe that was it. That was it for me. I felt completely lifeless. It was hard to even go to the bathroom. I was so extremely sick and weak that it was hard to maneuver to even get up. And I have a master bedroom with a bathroom in it. And it was even hard just to go from the bed to the bathroom to use the toilet. I do have several masks in my vehicle, and they get washed. I have worn masks. I have plenty of hand sanitizer. I've been one of those people that when I go to the gas station, I dump hand sanitizer on my hands, on the gas handle, and I feel like I have followed every precaution that I possibly could have, but I do realize that there are people out here that are not taking this serious and they are not wearing masks. They are not following the precautions that are necessary, and there are people that are dying from this, and they're not realizing that some of us are not healthy enough to beat COVID. There are people that do not have underlying health issues that are struggling with COVID. My son is 14 years old. He does not have asthma. He does not have any health issues that are known. And it's taken a real toll on him.
So what would you like to say to our followers for them to spread the word out there? What would you like to message to relay to them?
Please continue to wear a mask and wash your hands. Not only do you have to protect yourself, but you have to protect the other citizens around. I knew on Tuesday that I was sick. I immediately isolated myself away from other people. The symptoms grabbed a hold of me fairly quickly, so I knew that I needed to go and be tested. so that I could get my results and start the isolation process to quarantine myself to begin getting better so that I am not out running around spreading this virus to people that are not going to be able to beat it.
Okay, well, we really appreciate you taking the time today with the way you feel to kind of share your experience with those who will be seeing this briefing, and we really appreciate that. And we wish you and your son speedy recovery, and we just really appreciate it.
Thank you, Monica.
Thank you.
Thank you very
Thank
much.
you.
Thank you.
Well, there's another one of our county residents that is definitely a victim of this COVID-19, and we appreciate Monica coming on, sharing her story. When I heard about her and her son, I just thought it was important to have them to come on. 7.0 again today, Chairman. It was a week ago today. We went from below our 6.5, and each weekday we're creeping back up there, and we say it each day. This is 217 days. I just don't know. 5 more deaths today. I can't remember the last time we've had 5 deaths in one day. And when you look around the country, what's going on, for the people to think that this thing is over with, you are sadly mistaken. I had a conference call on another business today, and I had to remind them that this is not a light switch. Just because we were able to go back to our phase 4 part of the mitigation doesn't mean this thing is over with. This thing is here, it's out there. You just heard Monica saying she thought she was using all the precautions she could. You just don't know where this thing is at. But 5 more people, up to 213 of our county residents, are not with us. And I don't want to hear about they're old, because I'm going to be old. I'm old now. But just because we're 70, 80, 90 years old does not mean we have to die. So let's forget about all that stuff. Let's start thinking about wearing a mask, washing our hands, practicing the physical and social distancing, and together we can do something. What we got to do right now is, some of our surrounding counties, Chairman, are helping us. If you look at today, Bond County, Clinton County, we need some help. So anybody out there that knows anybody lives in Bond and Clinton County, tell them we're asking, please be a good neighbor. Reach out and let everybody know, go get tested, and let's stop this thing. If we can get these numbers down like the rest of these counties are starting to look at, like we've been doing, down to 3.5, we wouldn't have to be worried about this. People like Monica and them can get this thing behind them. And those of us can try to get back to some sense of normal, whatever that's going to be. So 7.0 today. We'll be back tomorrow to see if we're practicing what we're preaching, and that's be good neighbors to everybody, take care of one another, and let's start. This isn't a race. I told the chairman yesterday, this isn't a ball game where you get the most runs, you win. We want to go down. We have to go down. So tomorrow I hope we come back and we're below 7. And it's going to be Saturday. And it's going to be a nice day, so let's have some nice numbers. Sam, you're on notice.
We try every day.
I know you
Every
do.
day I come in here.
I know, and it's
when
not
we have
funny.
bad numbers.
But we have to be able to, please, I'm begging you, let's get lower numbers. We'll be back with Cindy and Daisy in a few moments to translate this into our Spanish communities. And everybody, please have a good evening, and we'll see you back here tomorrow afternoon. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close, just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Scrubs, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock